incontinence and what you should know about that is the subject of this video, so stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. Listen, I don't necessarily treat incontinence. I treat pelvic floor dysfunction, and a lot of times that comes with incontinence. One of the worst things for you to set yourself up for failure is your lack of realistic expectation as to what it takes to fix incontinence. So just having internal manual work to work on the 3 layers inside the pelvis as we're able to go in through the vagina and or anus is not sufficient. When you're talking about incontinence, it can be due to nerve issues, it can be due to the actual structure of your bladder, the integrity of the 2 types of muscles that the bladder has, and if they're working together, the integrity of the sphincter where the urine comes through to let go or to not have that strength behind it. Your positioning of your pelvis is a huge player. It hardly ever gets any attention. Just think about it. If your pelvis is like a bowl and you're tipping it forward, well, in front of it is your uterus, or not uterus, bladder, that when you're tipping it forward, it's going to put pressure on it. So it decreases the chances of being able to do a good job controlling your ability to pee or to hold it. So if it's tipped back, now it causes some issues with or increases your potential for constipation or hemorrhoid or issues related to anus. It's just common sense. So you want to have a pelvis that's leveled. So then how do you do that? There's so much controversy among the rehab practitioners. My go-to exercise is what's called DNS, dynamic neuromuscular stabilization, and the reason I love it is because all of us have done it as babies. We're programmed to do it. That's why every baby on this planet, regardless of the geographical location, goes through the same developmental stages of movement. So when it comes to a problem with that category, why don't we go back and do it the way we learned it to begin with? So I just wanted to bring that to your attention because I think we're not getting a good understanding of what it takes to become incontinent. So it could be urinary incontinence, it could be fecal incontinence, it could be gas incontinence. It doesn't matter. It is not just internal assessment of the pelvis that should be part of the solution. And you need to understand some basic concept, which is how long it takes for the problem to go away. Sometimes your symptoms go away, but the problem is still there. It's just waiting for just the right moment. So trust your practitioner that is helping you with your pelvic floor dysfunction. If you don't trust them, find a new one, but trust what they're saying. Ask questions, understand what is being relayed to you, and work with them in having a realistic understanding of the length of time it takes to solve your problem. I know that you already knew this, but sometimes it's good to hear what is obvious. Sometimes it's so obvious we don't see it. If you have not subscribed to the channel, this is your opportunity to do so. Make sure you turn on the notification. If you have any suggestions or questions, shoot me an email or contact me. Until next time, take care.